Many of you might think you eat right, you exercise, you feel fine. You don't need to go to the doctor. But sometimes, underlying health issues may not have symptoms or show up in your family history. I'm Susan White. For this edition of For Your Health, PNN visited President St. Joseph Medical Center in Joliet to hear the story of one patient whose regular checkup with his doctor saved his life. 65-year-old Shorewood resident Bill Ryan is an active man who hikes, snowboards, golfs, and even ran a full marathon. But months ago, he started experiencing shortness of breath, a cough, and what he thought was an infection in his lungs.
I'd been on a cruise. We got back right before Thanksgiving, so then I thought that it was just the cough, and I think it was just maybe like an infection in my lungs or something like this. And it didn't even happen all the time, but every so often when I would get on the treadmill or maybe take a walk or something like this, I could feel that. But I didn't think anything of it. So I had an appointment to see my GP, and I went in to see him, and I told him about that, and he said to me, which I thought was kind of amusing, he said that we're going to do a pulmonary test just to make sure about that. And he said, just in case I'm at your wake and your family says to me, did you ever think of a stress test? We're going to do a stress test too.
That stress test showed signs of blockage, and a trip to the cath lab revealed that Bill indeed had 99% blockage in his left main artery, a condition known as the widowmaker, for its likelihood to cause a massive heart attack, often resulting in death.
We called Dr. Tuchek right away because this type of blockage can suddenly close the artery and we would not be able to save his life. So we decided to proceed immediately to heart surgery. The availability of heart surgery quickly is important in trying to treat this type of a heart problem. And Dr. Tuchek's availability made it very easy, and it was a smooth transition from the cath lab immediately to the operating room.
It was this coordination of care, according to Drs. Kalivas and Tuchek, that saved Bill's life.
It's important because it allows us to be notified as soon as they hit the door in the emergency room, or even sometimes by the ambulance personnel notifying the emergency room. So the cath lab is immediately notified, Dr. Kalivas is notified, so they're waiting for a patient like Bill who came in with a heart attack before he ever gets to the emergency room. And then we were notified. I was actually leaving town in the parking garage driving away when they notified me. Immediately we had the whole OR team come in, expecting this to go bad, that is to find something that would require surgery, and then we were all waiting for him. So he got through the emergency room, into the cath lab, and right up to the operating room.
Going in, they said, well, probably if we find like a minor blockage, whether it be 40, 50%, we'll put a stent in, and you'll probably be home tonight or the next day, And then when they're telling me, well, you're going in right now, we're going to have to, to repair this, we're going to have to tear your chest open to do all that. It was just so quick. I guess I didn't panic and think, well, this is the end of the world or anything like this. But as they were wheeling me away, I'm thinking, well, gee, maybe this could be the end. I don't know. So I said to my wife, I told her I loved her, and I said, tell the kids I loved them too.
In Bill's case, he was healthy, had very little symptoms, and no known risk factors. But in many cases, managing health through prevention and knowledge of risk factors can be life-saving.
Most people don't know what those risk factors are. They include smoking, too much alcohol, being overweight, sedentary lifestyle, diabetes, high blood pressure, and family history. So clearly, if they have any of those risk factors, they need to see their physician.
I'm just so much more motivated than I was 2 months ago, before this happened. But now that this happened, this is just on my mind all the time. But the key, obviously, is to become that way beforehand. To educate yourself so and hopefully something like this would never happen to you. But it's obviously been an eye-opener for me.
Share the small steps you're taking to stay healthy. Find us at facebook.com/presencehealth. For Your Health, I'm Susan White, PNN.